Is in the newsroom to explain why.
Patrice Rondrell, COVID-19 is still a major concern for those who work in the public health sector. And the epidemiologist I spoke with says the virus is now going to be treated a lot more like the flu. 3 years after the onset of the COVID-19 pandemic, health officials say the virus is now changing into something more manageable.
We're seeing COVID move into being more of a routine cold and away from a pandemic. I think the bad news is we're also talking about COVID for the last 3 years now.
Graham Briggs is an epidemiologist with the Illinois Department of Public Health. He says the state is no longer seeing large hospitalizations like we were seeing in the pandemic, showing signs of higher immune responses. And the state is tracking different strains through wastewater throughout the state. Briggs says the end of the federal emergency, at-home testing, and other factors are changing how the state will track the virus going forward.
By using things like wastewater surveillance while looking at hospital admissions and severe disease and school absenteeism and a whole bunch of different things, we can kind of mash all that together and get a feel for what's going on with COVID in the community.
Briggs says this is very similar to how the state tracks the flu. And this marks a shift for how Illinois and other states' departments of health operate. Briggs says the department is shifting from a government task force into an office for information.
Our role now shifts from public health, from really trying to get out to schools and offer vaccine to kids, to really providing the best information that we can to the public.
And I also reached out to the Indiana Department of Health to get more of an idea of what their response will be. They say they are tracking COVID much like Illinois. Live in the newsroom, Caitlin Hunt, News 10.